Hello guys, welcome to Dr. Science. So today we are going to talk about doctrine Monro Kellie hypothesis. So as you know, the hypothesis states that the sum of brain plus cerebrospinal fluid plus arterial plus the venous system is a constant. So what is the basic meaning of this one? So suppose this is our brain here. Suppose this is the skull. As you know, the skull is a very rigid structure. By rigid structure, I mean it is a closed compartment. It cannot expand like tissues. It is completely closed and it is very hard. And here, as you can see, there is brain. And to this brain, there is arterial supply, which is supplying this brain with huge amount of blood. And not only that, there is venous system into which the deoxygenated blood will travel. And finally we have the cerebrospinal fluid. So the green color one is the cerebrospinal fluid. Since they are in normal size, the skull is in a compensated state. So what happens if there is a huge tumor here? There is a huge tumor and this tumor is going to grow. So what happens? It will compress the brain. It will compress the brain since it cannot expand, because the outer layer, which is the skull, it will not let the inner tissue to get expanded, because already I told you skull is very rigid and it is closed completely. So what will happen? The brain will get compressed and eventually there will be a neurological deficit. So I will draw a rectangle in order to understand this hypothesis. So this is a rectangle, and in this rectangle we are going to take, let's take, this is the venous system, and here is our brain. And this is the arterial system. And finally we have the, let's take this as the cerebrospinal fluid again. So this is the cerebrospinal fluid, this is the arterial blood supply to the brain, and finally here is the brain compartment, and this is our venous system. So basically the arterial blood will never compensate. I would like to say that the arterial blood, it will never compensate. Why? Because imagine the brain is a highly vascularized structure, right? And it need a constant supply of glucose and oxygen. So if the arterial blood is getting compromised, you will die literally. So obviously the arterial blood will never compensate. So this will never compensate, and the brain will also never compensate. So these two things are never going to compensate. So the only things that has to compensate is the cerebrospinal fluid. This cerebrospinal fluid, let me draw it clearly. So here is the cerebrospinal fluid. As you know, the cerebrospinal fluid, it's in the brain. So here is the brain. In the brain there is cerebrospinal fluid, and this is the spinal cord. This is the brain and this is the spinal cord. So what will happen? The cerebrospinal fluid which is present in the brain, it will get compensated into the spinal cord. So all the cerebrospinal fluid, it will go into the spinal cord, and hence the cerebrospinal fluid, it gets compensated. And not only that, since the arterial and the brain cannot compensate, the remaining one here is the venous system or the venous blood. Hence the venous blood will also get compensated. So basically what I am saying is that in a compensated state, where there is increased intracranial pressure, okay, obviously if there is a tumor in your brain, suppose this is the skull and there is a tumor here, there is a big tumor due to which there is an increased intracranial pressure, because the this tumor is compressing on the adjacent structures. Obviously there will be a increased intracranial pressure. So in compensated state, where there is increased intracranial pressure, what will happen? There is mainly venous, okay, venous and cerebrospinal fluid compensation. This is the compensated state. But in the case of the uncompensated state, there will be brain herniation, okay. So as you can, we will go to this diagram. As you can see here, the venous and the cerebrospinal fluid, they are right now they are compensated, but there will be a condition where there will be this tumor will be getting quite big and there will be increased intracranial pressure 2 times the normal. So what will happen? The brain here, as you can see here, the brain will get herniated out like this, okay. This is called your brain herniation. So suppose this is the skull of the patient, and this is the nose of the patient, these are the ears of the patient. As you know that there is a big hole, and this big hole is called as the foramen magnum. And obviously if there is a raised ICP or intracranial pressure, what will happen? The brain will herniate through this foramen magnum. I will talk about herniation in different types of herniation, brain herniation, in my next video, okay. So obviously the brain is going to herniate through the foramen magnum, and obviously the patient will have severe neurological deficits. Okay, so that was about Monro-Kellie hypothesis. Now I will talk a little bit of cerebral perfusion pressure. So what is meant by cerebral perfusion pressure? So imagine this is a brain. Let me draw it clearly. So here is your brain, and this brain is supplied by arteries, right? I will keep this as simple as possible. So this brain is getting supply from arterial system. So this is called as your cerebral perfusion pressure. It means cerebral perfusion pressure is nothing but how well is the brain perfused by arterial system, okay. It means how good the brain is getting the blood. So the formula of cerebral perfusion pressure is mean arterial pressure minus intracranial pressure. Now I already talked about what is meant by intracranial pressure. If there is a tumor and if there is a rise in intracranial pressure, what is going to happen, we will see. So the normal cerebral perfusion pressure is nearly 60 to 80 mm Hg. Now the main concept is here the cerebral perfusion pressure is inversely proportional to the intracranial pressure. So what will happen if there is a rise in intracranial pressure? Obviously there will be a fall in the cerebral perfusion pressure. So obviously if there is a decrease in cerebral perfusion pressure, there is decreased blood supply to brain, right? Hence this could be very fatal to the patient. Okay, so that was about cerebral perfusion pressure and intracranial pressure. Thank you guys.